Rural Healthy People is a body of work that we've been doing for quite some time at Texas A&M University. It builds on Healthy People, the initiative done by Health and Human Services at the national level, and really asks folks in rural America what's most pertinent for us to work on to really improve population health for rural Americans. Rural Healthy People 2030 is the third iteration of this. We've done Rural Healthy People 2010, Rural Healthy People 2020, and we're very excited to have the opportunity to keep this tradition alive at Texas A&M University. We're really fortunate in that the Federal Office of Rural Health Policy funded our initial survey. In doing this work, we really try to get direct feedback from rural stakeholders across the country as to what are the healthy people topics and priorities that we really need to be focusing on. In this iteration of Rural Healthy People, we conducted an electronic survey. The topics that you'll see represented in Rural Healthy People 2030 are a direct reflection of the items within Healthy People that rural stakeholders told us really should be focused on in the next decade. We got to take these topics and then look around A&M University and beyond, partners that we have in various entities such as health delivery practices, College of Nursing, College of Agriculture, and folks in the College of Education. We used this as not only a way for all of the expertise that we have at our disposal to be leveraged, but also to involve our students. So the future public health workforce, the future scholars and researchers that will be contributing to population health improvements. Really proud of the fact that we were able to identify folks within our reach that could contribute to what we know about these topics and what we should be thinking about going forward. Sort of thinking about who needs to read this work, and we're really proud that it's not just going to sit in somebody's academic office, but that governors and legislative aides, folks working in health departments, individuals who are perhaps writing grants, county judges, preparedness folks that are thinking about how do we improve workforce, even providers who are working in rural health spaces, insurance companies. All of these individuals will find some utility in reading this work and really thinking about ways in which we could think about holistically improving population health in rural America. The federal government does a new iteration of Healthy People every 10 years or so. We think it's really important to have some fresh eyes on what are the things that are pertinent to rural America. And to give you just a quick example of that, right? And so we just got through the pandemic, and we had been seeing access to care as being sort of the top-ranked issue in the history of rural healthy people at Texas A&M University. And this time, for the first time, we saw addiction and mental health and mental disorders really floating to the top. Given the fact that we don't always in public health have all of the resources that we would ideally want to be able to work on every single issue that is before us, we believe that it's really, really helpful every decade or so to throw a fresh net out and ask rural stakeholders, what are the things that you're seeing? What are some of the emerging and new iterations of issues that you're seeing in your communities, and really thinking about that in the context of healthy people. That's why we think it's important, and that's why we will continue to do this great work. So if you're someone that enjoys reading on a screen, you can access this work at srhrc.tamu.edu. You can download the full PDF. Or if you're someone like me who likes hard copies and you like to flip the pages and earmark things, you can request a free copy and we will mail it to you. The authors of each of the volumes have agreed in some measure to do interviews that will be posted on Twitter in the upcoming weeks. They're going to sort of unpack what went into the writing of their chapter, what they found to be interesting or unexpected, and you'll be able to get a bit more context for the work that you'll read in the actual publication.